I met with Dr. Barbir, and she is the most, this, oh, just sweet, sweetest, sweet. Oh, I don't even know what to say. She is a clinical psychologist and supervisor that serves a diverse range of adults and adolescents in her private practice in California. And she talks about one of her passions, which is using EMDR um, for adults who are struggling with depression and complex trauma, PTSD, anxiety, insomnia, and chronic pain. So she uses this EMDR to do that. Now, she and I got into a discussion, and interestingly enough, this is just how beautiful things work. But um, when I was emailing her talking points, I said to her, "Hey, would you be interested in sharing your personal journey that got you to the be who you are in as a clinical psychologist?" And she said, "I absolutely would." Well, my goodness, she knows through her own life experience about depression and about complex trauma. And her mother had mental illness, and she had some really deep generational wounds, and just needed to, I think, find a space for freedom in her life. And she did that by learning how the mind and body and soul works, and became a psychologist, and empowers others to find themselves and to look at themselves through a healing lens of compassion and self-love. She talks about intentional awareness, and when we approach ourselves with a curiosity that's non-judgmental, with that attitude, we can begin to turn forward and move forward and lean in to our story that makes up our context, that makes up our life, and discover who we are in a deeper way. She talks about her she was in grad school and talking about or learning about mindfulness, and how that moved her into self-love, and that she felt some anger, and that she felt some fear and shame and all these different things. She said because of the complex trauma, her body did not feel shame until she was 31 years old. And I just find this so interesting. She was so vulnerable and so authentic and so real. And oftentimes, when you are being trained as a clinical psychologist, you want to stay apart. That's the training, is to not insert your own experience into your client or your patient's life. And she has opened a window for all of us to know that while she manages her practice and does not do that in a clinical setting, boy, she was amazing and honest and vulnerable. And I know that as you listen to this interview, you will hold your hand out, and her heart will go in there, and you will not disrespect or violate it in any way, because it is raw, it's honest, and it's vulnerable, and it's the most beautiful thing to me, and I know it will be beautiful to you. Ah, she has a book. It's in the draft stages, and it will be coming out probably winter or early next year, 2026. I can't wait to have her on to talk about that. She is going to come on again, because we really didn't get to what EMDR is, because we were talking about a whole bunch of other things. So we will have her on for a part two at some point soon. But here she is. This is Dr. Barbir, and one of just a beautiful woman and a beautiful guest, and an incredible authentic interview. Please enjoy. Okay. Yeah. So it's Barbier, right?
Yes,
Yes.
Lara
Okay.
Barbir.
Lara Barbir. Okay.
Yep, you
I
got it.
I admit I do have a problem with names. It's just, and I try as I
Oh,
will.
it's most people go Laura or Lara, so you're in the majority,
Yeah.
actually, so it's fine.
Yeah, I only get the misspelling Lori with, multiple R's and some E's and some weird things, U's, and people add things to my name, but so I only get that, but Lori's pretty generic. But for you, it's I know a Lara, I know a Laura, but I don't know a Lara.
Well, now you do. Here I am.
We've been through the fire together.
Yes, we have. It's great. It's
What
great.
a way to meet you. With technology issues.
Yes, seriously.
Well, I was so intrigued by when I saw your profile come up, and I thought, "Oh, I've got to have this conflab with you. I have to." And I actually tagged you as my top 5 because I felt like there was something really important about how you are, what you're trained to do, your life, what the work that you do, um is quite beautiful. And the EMDR that I know you are skilled at is one of the things that I've been looking for to have conversations with people, because I've done it myself, and I can't say enough about it. I'm sure, you have so much to say. Well, what I
Absolutely.
you know what I wanted to start with is, I know you have a personal journey, and when we wrote, I asked if you wouldn't mind sharing your story, your journey, because not often do therapists or psychologists share, these really important journeys that they've been through that have informed how they move with their clients and their patients, and why they got into this whole psychology therapy aspect. So maybe we start by, how did you get here?
Such a deep question
Yes.
to set the tone for the conversation to come. I'm certainly excited for that. Um, Yeah, and this is admittedly my first time really being more open on the personal side about my own EMDR journey. So it's filled with a mix of emotions currently that I'm internally noticing and just mindfully observing, which I'll talk to you about as well as it relates to emotional health and well being. Uh, yeah, where do I begin? Well, I'll share that I have had my own personal journey of depression rooted in complex trauma, and that's really become a niche area within EMDR, the EMDR therapy that I do. I would say I was formally diagnosed with depression as a teenager uh, amidst hormones, an ex stepfather who was sexually inappropriate and abandoned our family as well pretty suddenly, and have not heard from him since. A mother with severe mental illness who has since passed away from a cancer that was related to a lot of issues, inflammation in the throat caused from an eating disorder and alcoholism, which are rooted in complex and unresolved trauma. Um, so, in a nutshell,
Wow.
that's why my journey really is to try to help people um, stop uh, generational wounds, stop transmitting wounds, and be able to come inward and resolve their own trauma that, of course, manifests in a myriad of ways. Depression is one way certainly, but depression can also manifest across disordered eating, addictive behaviors, whether in alcohol or drugs, or eating, or more obsessive compulsive type behaviors, relatedly perfectionism, you name it. I think if you were to ask me, my bias is that a lot of the disorders in our book are rooted in unaddressed and unresolved trauma, both from our own personal lived experience, but also, of course, the experience that's passed down to us that we essentially inherit from those who uh, are supposed to be caring for us.
Thank you for opening up and sharing that with me. I really appreciate it. And I know that's vulnerable, and I know it's not always easy to open in that way to say, hey, look, this is sort of my context. This is how I saw the world for years in my life. And that's not always easy. And so I identify with many things that you said there, from my own personal piece. When you started to heal, like, what was the catalyst for you?
I say that it's heartbreak. I think it was the experience of true unconditional love. Um, and I go backward, and I also think though that um, my brain likes to analyze, like, well, was that it? Is that the story I'm saying? Was it also many other things? I know that when my mom was diagnosed with cancer in 2012, which was also around the time that I turned 22, my brain was now fully developed, maybe a little more awakened in that sense, and I had just started graduate school as well. um, that was also a period where I was first introduced to mindfulness based therapy approaches, and mindfulness definitely changed my life. So, but I think also a huge catalyst to my EMDR journey
Mm.
specifically was the experience of uh, heartbreak for sure.
Can we
Um,
talk about
that
that for a minute? Because I often find, for me, I'm still in heartbreak, and I would imagine you are too. When you have a complex trauma that it's, for me, I've made peace knowing it's a lifetime of resolution. It's not probably going to go away. And I'm okay with that because I've come pretty far along the journey. The one thing that I have a very, very difficult time with is the heartbreak. And I don't know how to say it because it comes through my body somatically. So I get lots of bronchitis. I have like all, like, it's really interesting. And I work with somatic therapist to sort of let it go. But what I find now, mindfulness was my catalyst as well. Help me embrace the heartache. And then it just comes out. Like it, and I get a tightness in my heart, in my heart space, in my chest, and I feel the weight of it. And then I learned how to let it go. When you're dealing with clients or straight patients, when they have had complex trauma and you lead them to mindfulness, how and what do you focus on with them? Because so many people don't know where to start. So if they start at mindfulness, many people are like, I'm sitting and I can't sit for more than 2 minutes, you know? So how did you do it firstly through your own experience? And then what do you do encouraging others?
Yeah, such um, a an important question, and I'll also respond to like the somatic experiences. I forgot to mention at the age of 7, my own PTSD depression manifested as rheumatoid arthritis, which is of course very rare at that age. So it's a very juvenile form, not inherited again. And we actually do know that many autoimmune disorders are connected to post traumatic stress. through inflammation. So, yeah, just goes to show that depression, trauma manifests not just in psychological disorders, but most definitely also physical ailments. And yes, trauma involves the experience of heart breaking and gut wrenching sensations. Absolutely. Um, I recall in my earliest experiences in graduate school, I was in a mindfulness based cognitive therapy class. And I just, for some reason, to practice mindfulness and with you right now to help you understand how I experience it, I remember sitting in our group and we were sitting on the floor in a group circle. And at some point I have a flash memory of talking about having learned about my mom's cancer. And there was just a stillness that I hadn't really experienced before. It was almost like up until that point I was going through the motions.
Mm.
Um, and I don't know, there was just like a moment where I could stop and just be with my experience, and it's coming up now as you notice. And I'm trying to just allow it, you know. That's the hard part, but it comes out in whatever way it needs to come out, and um, that's how I relate with my clients, who I see as well, right? I just try to be fully present with their experience in a loving way.
I really appreciate that. Fully present with our experience in a loving way. Um,
Which means without judgment, right? You're and the problem well, the solution and the problem as humans is we are wired to judge, to immediately make judgments
that,
about
yeah,
things as safe or unsafe, good or bad, and therefore safe or unsafe. And those immediate
right,
judgments, of course, lead us to react to try to
right.
survive. Where it becomes a problem, of course, is where we're trying to constantly problem solve our emotions and trying to change our inner experiences, which aren't meant to be changed. So we paradoxically end up escaping the present moment when the pain that's coming up, the heartache that's coming up, is really begging for your full presence and love, but our instinct and our wiring kind of encourages us to do the opposite, right?
It does. Our internal wiring encourages us to do the opposite, run, fight, flight. It encourages us to step out of that space where you and I right now are both crying. And so, but your vulnerability has opened me to my vulnerability, and
Yeah.
I'm not carrying your burden. However, your vulnerability has opened for me the space where I've been down the roads that you're describing. And so that emotion comes rushing in and says, one more time, we want to be free. One more second, please let me just flow the way I need to. I always see the body like water. And and when we are allowing the water of our everyday experience to move around the boulders or the blockages that complex trauma or trauma experiences, big T or small t, um, it it water wants to soften the edges of those barriers, and it wants to soften that. And that's why I say I'm okay with it being a lifetime, because it's those things that made me who I am today. And they also need to be um, let go on a daily basis. And so you really said it well for us who are listening. Um, Opening the space for our bodies to speak through us. that's something that when you have a traumatic experience, you aren't allowed to do anymore. Yeah. And then the whole body shuts down. So, with your
Yeah.
rheumatoid arthritis as a young child, how did that play in to what was happening in your life?
Um, Great question. Uh, It happened around the time that my mother and father, they had already been separated and divorced, but they had tried to get back together. And for a very brief period, we moved. I grew up mostly in Virginia, and we moved to Northern Virginia and got back together. And it was that just a few months after that that I woke up one morning with my knee so inflamed and swollen that I could not walk, and it was terrifying. Um, I also That was also though the period that my mom and ex stepdad, they were just dating at the time, had broken up, and during my EMDR journey, I uncovered a memory that I had repressed where he was inappropriate with me when they were still dating. So I'm imagining that. Amidst the physical stress of the move, my parents getting back together, that probably being triggering of little Lara's experience of their initial separation and divorce, which I also don't remember, but my father was allegedly violent with my mother, and I witnessed this, but don't have any conscious memories of this. I think my body probably holds it though, and that's maybe what was sent overboard when they reconnected. And so little Lara was back and forth between mom, stepdad, or dad, stepdad, dad, stepdad,
Mhm.
and then amidst some of the other abuse and severe emotional neglect. I don't believe that was the intention, but as I think many people of our generations learn that we're not necessarily taught to understand our emotional experience. And so I think emotions learn to manifest themselves in somatic ways to actually help me get the attention and love that I was likely needing from my parents, which lo and behold, not being able to walk and go to school definitely forces your parents to take care of you and get you the care that you need.
Yeah.
Um, yeah.
Wow. I remember for me, as you say that, I remember making myself throw up before school. And I would just, and it wasn't that I was doing anything physically to make myself throw up. I actually would have so much anxiety that I would just throw up. It was like all of those thoughts um together because I couldn't um function well in school. I was in survival mode in school, so I couldn't learn. For me, it was just this blockage, and that, obviously polarized me in many aspects. But what I know now is that when everybody was gone out of the house, that was the time where I was restoring, where I was able to breathe a little bit and just kind of relax and then get myself ready for the next hours when evening would come. So you were in graduate school when you began mindfulness. And what did that look like for you? And was it difficult to enter into mindfulness having that survival, switch on? It's hard to turn that off. What happened for you?
Um, I Again, I don't know how much of this is a function of my brain fully developing by the age of 22 versus mindfulness. I'm sure it's a complex formula and combination of both, but I had a lot of trouble with anger, and of course that complicating with mother, and mother being in denial, being an addict herself. My anger, I of course came to understand, was a valid and a reaction to my circumstances and trying to take control, of because of feelings of helplessness and fear that my mom's behavior would lead to her death, which it ultimately did. Um, so I had a lot of trouble with anger, and I recall that mindfulness helped me really, mindfulness combined with the grief, and really just like started peeling these layers off of me and making me more emotionally raw, for sure.
Mm.
With her death in 2018, that definitely, I would say, it peeled even deeper layers of rawness, and I felt, um, uh, in a meaningful way, I felt more deeply connected to things around me. As painful as it was, it definitely made me more connected to my work, and gave me a new layer of empathy, for sure. But yeah, in the experience of mindfulness initially, I think I recall the ability to actually understand what's beneath my anger. I was in that, of course, class setting, and had the benefit of going through mindfulness based cognitive therapy, and reading the book, The Mindful Way Through Depression, which I highly would recommend. Haven't read it since then, but that definitely opened me. And at the University Counseling Center, I was in a dialectical behavior therapy group that focused on mindfulness and emotion regulation modules specifically. So those were my initial introductions to mindfulness
Wow.
specifically. And I think, of course, yeah, a long road, and a forever journey that I'm committed to. I think it's really mindfulness, self-love, unconditional self love of the self is a journey, and a very meaningful one. And in my book, what I'm really writing about, in my book about EMDR for depression specifically, the journey is really acceptance, and acceptance requires mindfulness and self-compassion. And EMDR is also a very useful tool on that journey.
Mm. Um, just going back quickly to anger, I always found anger came really quickly to me as well. And I know lots of people, that's what happens to us. We get angry first. And I've learned that, and you can obviously, weigh in here, but anger for me, the emotion meant something. It meant, what do I need to protect? Something is not being protected here. And I need to call in some form of protection to help me with this situation, with whatever I'm experiencing. It's like, it's asking, what do I need to protect and what do I need to restore? Because there's something broken. And the body and the soul doesn't want brokenness, or not broken, but fracture. It doesn't want the fracture.
I agree. I think every emotion has an important message to us, and I would agree. Anger usually is an emotion warranted in situations where there's some sort of injustice or a need for defense or
Mhm.
protection. I will also say, when complex trauma is involved, usually an experience of anger is not just the simple emotion of anger. Usually, especially if it's unresolved trauma, there are many other emotions beneath the anger. Um, a huge one being fear and helplessness, um, shame, guilt,
Yeah.
and deep sadness and grief.
I resonate with that. I resonate with that. I just had somebody on the show. Her name was Eileen Lashinsky, and she said to me, we were talking about shame in the body, and she said to me, we were just talking about our experiences, and I brought up something that had happened to me, and she said, "You know, Lori, you are not their shame. That was their shame. That was their shame, their fear, their rage, their anger, their context poured out onto you. You did not. You did nothing to have that." How do you reconcile that, as with the knowledge that you have? What's
Yeah.
the reconciling process for you?
Uh, to put shortly, acceptance, which is
Mm,
comes back to, of course, understanding that is a projection of and hence where intergenerational trauma is born and continues until someone becomes conscious that and I think where it comes and where the compassion comes is first logically recognizing, well, even though they're in a reactive state, I know that they probably didn't intend to cause harm. So when you can recognize that, you can take a step back and then first and foremost acknowledge your own pain and what has been transmitted to you. Oh, I've seemingly internalized this projection. They're telling me and sending me these messages that something's wrong with me. It's actually a reflection of their inner world and how they see themselves. And though, first, though, I can recognize that I internalized their projection as if it were a truth, as if I'm wrong, as if I'm broken, I'm flawed, I'm defective, I'm unlovable. So I think part of the journey is first just acknowledging your own experience, acknowledging the hurt, the anger, and part of that, of course, is our own denial. There might be some blaming, or on the opposite extreme, there might be this overly forgiving at the cost of acknowledging your own wounds of feeling unloved and unwanted. So I really think it's just learning to be with that uncomfortable, painful experience, allow those wounds to come up in the way that they need to come up and in the bits and pieces, because we cannot necessarily just solve that all at once. And we also aren't if our intention is to solve it because we want to control it and change it, then it's counterproductive. So we have to be very careful and very conscious and intentional about whether we have a sneaky agenda. We don't want to have an agenda with acceptance. Acceptance is what I'm feeling is okay, and which is why it's a journey. It's not how we are wired when pain arises.
yes, it's
So
not.
in short,
It's not.
it's the learning to love ourselves,
Yes.
and part of loving ourselves is when we feel this pain, instead of finding ways to escape or solve it in the many sneaky ways that we do, it's just about being what we needed, right? Being the emotionally attuned caregiver that we never had, instead of neglecting ourselves. And I think that's a big piece of and what the research shows. A big contributing factor to adult depression is emotional abuse and neglect. And then ironically, of course, we internalize the teaching to neglect ourselves, and part of ourselves being our emotional experiences.
Wow. Being what we needed instead of neglecting ourselves. That is, a really important takeaway. I have a question, and maybe this is really overstepping for me. So if it is, oh, I will just delete this portion.
It's
But
okay.
um, you mentioned, and I wanted to tag into it because you were talking about the reconciling of anger and that sort of thing. But underneath, as you shared your context, you shared sexual inappropriateness. And I have been, and I would say I no longer am a victim of that. However, I was a victim of it because it happened to me. It's
Thank you for sharing.
thank you for creating the space, and being your vulnerability has offered me the ability to say, hey, I do have a question. This is my search right now. And currently I'm in process because You know, something that I thought was really powerful is we 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 step away from ourselves when we are harmed. How do you speak to the women and the men in the world who have had something happen to them inappropriately, and give them the words or the wisdom to be able to start asking and exploring this piece that is so fragile?
Patience. I mean, I was going to say love, but and love is patient too, right?
Yeah, but patience is more, because we really want to fix stuff and get it out.
Yeah, and that's not
Okay.
how love works.
No.
That's not how the spirit works, right? Our ego has this sense of urgency and wanting to control things and to get things done as quickly as possible, and that's not actually what we need.
Wow. Patience. So patience would be to say to ourselves, what do we say to ourselves to give us the affirmation that we're not, so if we're back to the water with this trauma boulder, we're not trying to divert the water somewhere else. We are saying, this is a trauma boulder. Something happened to me that was inappropriate, whatever the scale may be. I see it, I feel it. Now I got to have some patience. What do we say to ourselves so that the feeling of pain and sadness and grief and loss can subside while feeling like it's allowed to be a part of the journey at that moment?
I think it's an unfolding and requires daily practice. And the good news, or not, is that life gives us opportunities to practice every day. We're triggered uh, all day, every day, especially if you have complex trauma. The triggers are everywhere unless you've gotten really good at avoiding,
Mm.
which is of course part of why there's a lot of patience required with this journey, because the likely case is you've learned to dissociate, you learn to numb yourself, you've literally repressed memories, and repression is not something to blame yourself for. It's a response to extreme stress, to extreme trauma. And so it's recognizing that the journey is not linear,
Mm-hmm.
so that you can better manage your expectations. It's about practicing mindful, loving awareness when you do become triggered, each time you do become triggered. And that's not going to be perfect, of course, because we're not meant to be perfect, and there's beauty in the imperfections of our experience. Um, yeah, it's learning to give ourselves grace, which I think means when you can catch when you're triggered is the first part. Especially in the beginning stages, a lot of times it's very difficult to even become aware when you're in such a reactive or triggered state, which is often why people come to therapy and look for support in therapy, and they look for support in relationships where their body tells them that they feel actually safe. So I would say trust your nervous system. Uh, uh, in healthy ways, rely on and nurture the relationships that make your nervous system feel safe and warm. And practice telling yourself it's okay, first and foremost,
Mm.
whatever's coming up. try to say it and really mean it, right? Like I said earlier, no sneaky agenda of like, okay, I'm going to say it's okay, but really beneath that, I'm saying it's okay because I want this to pass.
Right. Because the body knows when you have a
Yes,
sneaky agenda,
exactly.
and then all of
Right.
a sudden you find yourself back in this really weird situation, and you're thinking, I thought I'm in a vicious cycle. I thought I did this stuff. And the body goes, no, see, here's what you did. What you we're trying to bypass. And we can't bypass. We gotta like stay in the game. Um, EMDR for me, and maybe we can begin to talk about EMDR. Um, I wrote down here, we lose our body and lose ourself to our experiences. Many of us have feel like that. You just feel like you've been lost in the experience when you were 6, when you were 40, when you were like 2 days ago, and you just don't know how to get out. For me, EMDR was the beginning of the experience. It was a relief valve for me. I had 2, maybe 3 sessions, and it was incredibly powerful. Would you be able to share how you came to EMDR, and then what that did in particular for your own experience? We can talk about your patients, but I think right now we're talking about your story and how it impacted and adjusted something or changed or transmuted. And that's where I was thinking we could go with that.
Sure. I will continue the self-disclosure and continue to mindfully observe my discomfort in my body with this new experience for me of this vulnerability, which feels very meaningful at the same time. I will say, and I've told this to others before, my when I think about my healing journey, there's a formula. It's not just one thing or another thing. It's an amalgamation of things, and how I'm literally committing every day, where I'm putting what I'm putting my energy toward. Mindfulness started in from my early 20s, um, maybe fell to the wayside some years, and then became a regular daily consistent practice probably for 5 years now, consistently. So that training my brain to and mindfulness is about being aware of the present moment in a non-judgmental way. So it's those three parts you're training: an intentional awareness toward your inner experience and in the moment, using a curious, non-judgmental attitude. I tell clients, it's almost like you're a basic scientist who's observing this experience like you've never seen it before. So you can't actually put a label or a judgment on it. It actually, that helps us turn more toward our experience with curiosity rather than fear of, oh no, I can't go there. Right. When we judge that, immediately judge that, oh no, I can't go there, that's where we start escaping and turning away from our pain, which is begging for our love, ironically.
Mm,
I started EMDR. So, of course, mindfulness, meditation. I have to say, exercise has been huge for my mental health,
yeah.
and confidence. I'm a body pump instructor, which is a total body strength workout. That's really a big part of my journey as well. And a loving and supportive community makes life much more meaningful, and helps me definitely internalize feelings of acceptance and love
Mm,
unconditionally. And then, of course, nourishing my body with limiting alcohol and drugs, eating whole plant-based foods, especially since I have an autoimmune disease, and engaging in meaningful activities. I am a huge psychology nerd. I love astrology as well.
Mm.
I love my cat, who's still sitting in my lap right now. And my family is as difficult as they may be, so I stay connected and try to and definitely equate my journey to the people and those rituals that I try my best to adhere to. EMDR started for me in the end of 2021. I started more with the focus on the grief of my mother, and that took us to childhood memories, working on memories tied to my mother, which is also true for a lot of clients. Working on those attachments, like you said earlier, those little t or small t traumas are sometimes just as, if not more impactful than the big T traumas because they involve feeling loved and feeling seen. And as humans, especially as children, we all have basic natural needs to feel like we belong, to feel seen, heard, understood, appreciated, attended to, and emotionally tuned to. And of course, if a mother or caregiver is depressed, have severe mental illness, the truth of the matter is, even if they don't intend it, they have difficulty being emotionally attuned, especially if they hate their own emotions. Then of course that's going to be projected onto you. So I would say a lot of my early EMDR experiences were, of course, focused on chronologically working through childhood memories that involved interactions with her, and then of course also with my stepdad, some with my dad, and then some with my ex, who I was with for 10 years, who was very much I learned realized like my mom and also my dad in certain ways, um,
Interesting.
verbally, physically, emotionally, and sexually abusive. So and I was in that relationship for 10 years, but of course I knew that that was very much tied to a parallel to my relationship with my mother, who was the one in my life the most compared to father and stepfather. So that's why that was the main focus. I had mentioned before, or perhaps I didn't, that I repressed a lot of memories and learned to find comfort as a teenager through my mother was not someone who was emotionally safe to go to. Um, I think would find comfort from friendships, but not necessarily be emotionally open. I did like to journal as a teen, and I did like education and extracurricular activities. So there were definitely some healthy coping mechanisms. On the unhealthy side, of course, I dissociated and numbed myself from my feelings. Um, and looked for love in the wrong places: sex, drugs, and alcohol.
Mm.
And uh, really, what did come out was anger, of course. But as I alluded to earlier, there was a lot more beneath the anger that I wasn't addressing and didn't really know how to address. And of course, the people around me, like my mother, had no idea how to address it and didn't want to face her pain. So how could she want to face my pain?
Right.
Again, not the intention, right, but the outcome is an internalized of I'm not lovable. My emotions are not acceptable. I actually had a suicide attempt when I was a teenager. That was a cry for help and also part of a black box warning for taking Zoloft, and it kind of motivating me to care less and to do something about that. And it was met by my mother with anger. My mother was angry when I went to tell her when I woke up the next morning, not thinking I was going to wake up. So that further damaged this idea and this like my emotions should be neglected. I literally don't matter.
Right.
I'm a burden.
Right.
Um, I didn't experience shame in my body until I was 31 in the middle of EMDR. And it wasn't even in the middle of my EMDR session, it was maybe a day or two after. I remember thinking of the guy, the catalyst of the heartbreak that kind of put me on this, that motivated me to this journey of self-love, knowing that I'd like to be a mother one day. And by gosh, I'm going to do it right if I'm going to be one. Going to do my best, although I know I'm going to mess that up too. I uh, remember driving home, and I had this feeling of like a pit feeling in my stomach that I had never had before. And so naturally, I was a basic scientist in that moment because I was like, what is this? But then, of
Yeah.
course, being a psychologist, I went to my um, DBT, one of the DBT handouts, dialectical behavior therapy, that describes biological experiences of certain emotions. And I was like, I think this is shame. So I went to shame, and biological experiences of shame include having a pit in the stomach. And I was like, oh my God, I think this is the first time in my life I've ever experienced shame.
Yep.
Wow. So I have to attribute that to the work of EMDR and the somatic work it does. I was like, wow, I've literally been blocked and disconnected from my body for so many years, which is so common for so many people who are traumatized, especially when sexual trauma is involved.
Yes.
Unfortunately, not only was my stepfather sexually inappropriate, I was also sexually drugged and raped at a party in high school during that period after my suicide attempt, where I didn't care about anything. So, and put myself, of course, in situations, of course, that not intending for things to happen, but things happened. Um, so yeah, I really, really blocked myself from my feelings, as a lot of sexual trauma survivors do. And yeah, a psychologist didn't feel her own experience of shame in her body until 31 years old. So yeah, I'm guilty of
I
that.
I really appreciate your vulnerability with what you've shared. That's, you know, I just had a thought as you were talking, and because you're going so deep, and this is so beautiful. And I want to save you from tomorrow when you wake up and go, I gotta email Lori and say that we can't air the show. Just saying. Because your experience is so important, and to share it is just it it is it's so beautiful to me. And I just want to thank you in the middle of this for being so honest. And you know, there's no right way to respond and say, oh, this is for the good of others. No, it's not. Actually, this is vulnerable to you, and it's your journey. The one thing that when I started sharing what had taken place in my life, the one thing I realized is the shame started to go away as I spoke it out loud. And
That interesting.
it was so profound. That level of I think it's a level of consciousness scale or something. I can't remember. I'll put it up in the notes in my blog and stuff. But there's a level of consciousness scale where it shows all these emotions, and shame is it shows all these really high emotions, and then there's a line, and then it goes all the low emotions that are really low vibration. Shame is before death. It's that low. And that's why I remember me feeling the pit, never knowing what that pit was, never understanding what that pit felt like. What is this pit that I feel in my body? It was this incredible space that, like you say, is generational wounds, generational trauma. And we're talking like the ancestors, the people that have gone before us. For me, the women in my life who had the very same inappropriateness happen. And it is, it is the shame of the generations. It's the shame of your own self, and it's their shame. It was the one thing I realized, I think it was yesterday. The person that was inappropriate with me felt shame too. And that was then put on me in double. and you're unraveling all of this.
Makes it so complicated.
And it's so complicated. And yet, here we are. And for me, the EMDR was a space where I could snapshot. I didn't have to relive the moment. Was that your experience as well?
Yes and no to make things complicated.
Yes.
Um, and as an EMDR therapist, I'll say you're right. The EMDR therapy is different from other trauma focused therapies in that you're not instructed to relive it as in the first person as if it's happening all over again. You're actually instructed to look at it as if you're watching a movie of your younger self. And naturally, though, what can happen for many people is they start in third person and then they might go into first person. And sometimes I just intuitively believe that people need to trust if that happens, it's happening for a reason, because perhaps you're meant to kind of feel things that you were completely blocked from at that period. Um, so, but you're right in that it's not necessarily a reliving, it's a third party perspective so that the the compassionate, empathetic part in your prefrontal cortex can be on board and be like, oh, this thing is happening to that person, and I just feel so much pain for them in a compassionate way. And that's really what healing is. It's to be able to look back through a lens of compassion and love rather than fear and shame. Of course, though, part of the journey is overcoming the fear and shame, allowing the fear and shame using mindfulness and acceptance-based techniques, and so that you can then your perspective can shift. Which is
Mm,
why I think for many people, myself included, sometimes it's hard to not relive it initially because maybe you need to feel that fear with in your current state where perhaps you have more resources than you did before, if that makes sense.
hmm. It does make sense. So, how do we begin the journey of emotional health, though? Because we're talking a lot about the dysregulation from life and circumstances and everything, and so how do people find groundedness or regulation or even safety in their own body? uh, I'm I'm learning about this as I go through conversation after conversation. I'm learning about this on the daily, and it's okay to not feel safe in your body because of life experiences. It's also okay to say I'm learning about this every day, and I'm going to choose to lean into whatever my body needs. That's what I hear you saying. So how do we begin the journey of emotional health?
Yeah. Well, certainly for anyone who is listening or watching, you're already on the journey. So I will reassure you, you're doing a great job and trust yourself first and foremost.
Yeah.
Uh, to share from my own journey, of course, that involved pursuing my passions and mindfulness falling into my lap and finding a way that you can start to be still with yourself and your experience
Hmm.
and drawing on whatever support you need that you can access, of course. Prior to that, though, definitely a necessary prerequisite is making sure you are in a safe situation. Because if you are still in a violent situation where you're not safe, it's going to be hard to do the work. Your body's going to continue to communicate that you're not safe if you're actually not safe. That's the tricky part, though, is when we're traumatized, the past influences the present, where we feel fear even though the fear may not actually be warranted, and from a logical perspective we are safe. But it is important to make sure that you are, logically speaking, in a safe situation and space before you can even embark on this journey
Mm.
to
Mm.
emotional health. And then, yeah, finding ways to honor and respect your emotions and to turn toward them, as we've been talking about, which of course many people turn to therapy for. They turn to their community as well. I'm very much for alternative, complementary and alternative medicine and healing modalities aside from psychotherapy, which of course is very westernized, and not necessarily the only way. For anyone who's read The Body Keeps the Score, right? There's also an emphasis on exercise. It can be light exercise, it can be yoga, meditation, tai chi, dance, any form of dance, any way that you can get your body moving. Of course, for me, that's body pump and teaching body pump too. Um, that is very integral. When done consistently, uh, aerobic or anaerobic exercise acts as a natural antidepressant. So it is essential to your healing and your emotional health. Prioritizing your basic needs cannot be overemphasized. Making sure you're getting enough water, healthy food, enough sleep, and enough rest. Uh, and enough, of course, yes, exercise and activity. Um, that all of that, of course, is essential to our emotional health. As we know, of course, when we don't get a good night's sleep, it's going to affect our mood and our emotions,
Yeah.
especially if hormones are involved. Um,
Yes.
so those basic needs cannot be overemphasized. Mindfulness, exercise, meditation, other modalities aside from psychotherapy. But of course, my bias is going to be towards psychotherapy if you have severe trauma that you've never really faced before. Therapy is an excellent first step. And connecting yourself with loved ones, joining different groups or communities that maybe support emotional health and sharing
Mm.
are very important. Music, I love music so much. Both the act of going to concerts, of listening to music, and going for walks on my own, of pet therapy. Soko is still very much in my lap right now. Of animals, I mean cats and dogs specifically, maybe not lions, tigers, and bears, but
Sure.
cats and dogs are also anxiolytics. They lower our blood pressure.
Mhm.
Snuggling releases oxytocin, lets love in, finding ways to let love in. When you can let love in and calm your nervous system, you'll be in a better state to turn toward your inner experience.
Mhm.
But as we mentioned before, patience is the name of the game here. This is not it's something that you undertake in a matter of days, weeks, or even months or years. It's a commitment, I think, to a lifestyle.
Yes.
For me, I think self-love is a lifestyle. It's how you're choosing to show up for yourself and not abandon or betray yourself every single day.
Amen. I mean, I'm learning how to not abandon and betray myself every single day. I am
I'm
learning
also
that.
learning.
And
Yes.
and I know it feels like that, and so how do we find resilience and belonging and meaning in the in that moment where we either share the trauma with someone or we have the awareness of the trauma just to ourselves? How do we begin to find a level of resilience? I think really you've answered the question with what you just said. But is there anything else that contributes to that?
I think what's also important is pursuing your passions. Maybe I haven't talked as much about, but being clear about what you want in life, and not only thinking about how do I heal, but also thinking about, well, what do I want to create? Oftentimes we might get a little too hung up in I need to right fix this before I do this, and while that's well intentioned, sometimes it's a little tricky if you're making your happiness dependent on fixing something, right? Happiness is right here, right now. And to that point, I recommend journaling and including gratitude in your journaling to help rewire your brain to let in appreciation, joy, love. Those are not things that as humans we're wired to feel. We're not
No.
wired to feel happy. We have to train our brains, and the science behind positive psychology, which studies how why people are happy and why people flourish, show that practicing gratitude every day can help retrain your brain to and when that becomes a habit of being, you will be more likely to feel appreciative in the moment of little things, and that's how you experience more happiness. Other ways we experience happiness are, of course, pursuing meaningful goals and not only focusing on the destination but learning to be present and mindful with the journey and all that the journey brings in the pursuit of meaningful goals. And that's where for me that's like, well, pursue what's passionate, for
Hmm.
what makes your soul and your heart feel alive. Listen to your body. Put yourself out there, meet people, make conversations, see what resonates with you the most,
Yeah.
trust that, and keep following that. um, think back to, and of course this is where you integrate inner child work, think back to the child in you. What sort of dreams and aspirations, or what figures, whether in TV, movies, cartoons, or in your real life, did you look up to and aspire to, and what can you learn about your soul's essence in those inspirations from the child in you? Because I think that speaks really to our essence and being in alignment with our heart
Wow.
and our heart's desires.
Yeah, being in alignment with our heart and our heart's desires can help us repair the relationship with ourselves, right? So, because one of the things that I'm thinking about as you're talking is, you know, when you have someone in your life that harms you in some way, right? Or they don't treat you right, like we've talked about, then there's always, then, and there's another parent involved and they don't speak up for you, then I find other coping mechanisms to work out my own sense of who I need to be and how I need to be treated. Except that resulted in anger, all kinds of, protection, insecurity, all kinds of things. I'm learning now how to repair the relationship with myself, because what I learned from my life experience is that if I carry everyone else's emotions, everyone else's pain, then they will never harm me, because if I can carry their burden, then I'll know what is going to come and punch me right in the face. So then I can be safe. And so I think as we wrap up, I think that's a really, if you speak to that, then we can go into the next piece, which is just sort of bringing ourselves into a space where we can hear this, and then what do we do with what we've heard? I think that's the other piece.
Absolutely.
Yeah. So how do we repair our love for ourselves if we were the only person that we felt was safe, but now we ignore ourselves and we don't know who we are?
Yeah, that's a challenging one to answer. There's a part of me that that instinctively says, well, part of our basic needs is love and belonging. So and so hopefully part of the journey is helping you find that
Mm,
love and belonging, finding your community, your soul tribe, your soul family, so to speak. Another part of me says, well, how can you start to be there for yourself in ways you haven't been there for yourself before? What was it that you were missing in your life experience to date that you're probably needing? Um,
mm,
that curious, compassionate parent, perhaps treating yourself like you would treat a genuine friend,
yeah.
showing
Yeah.
up for yourself in the same way that you show up for others. Someone once told me that you uh, become, as an adult, what you really needed as a kid, and that spoke to me. So
Mm,
that came to mind as well to share
yeah,
with others of how to repair the love.
yeah. That
It's
speaks to
often
me
the
too.
people that are, yeah, it's often the people that are the kindest that uh have the deepest pain.
Mm, mm. It's true, isn't it? Wow. Mm.
But it's hard to turn that kindness inward.
It
As we
is.
definitely know from trauma, there's a lot of
Yeah.
self-loathing, but there's also just like a complete self-neglect at the same time.
Mm,
So yeah, it's taking it one day at a time, one breath at a time, even.
mm. Hmm. I like the one breath at a time because that feels like, I just do this involuntarily. I breathe, just that's, I've always been breathing, and so that gives me that sense of, okay, I can plug into that whenever I need to, that breath piece. So as we wrap up, um, so for people who listen to this and they go, oh, where do I start? Maybe they identify, maybe they, now they also have a memory, or just, they feel this overwhelm or compassion, or maybe they feel a pit in their stomach, maybe they connect to some emotion that we've talked about here. Um, what do you say to that? How would you help someone just lean in to what they've just heard?
Well, for one, start with connecting to your heart by
Mm,
answering truthfully, why are you really here?
beautiful.
Deep, deeply within your heart, why is it that you're here? Are you actually here, right? Sure, you want to heal from trauma, but and why? What's drawing you toward that?
Mm, very good. I only laugh because this is the most profound conversation I've had in a really long time. And
Really,
I, I feel so blessed. I feel so blessed to have been able to
likewise.
sit with
Thank
you.
you
And
for
I'm so
your
glad that we
safe
didn't have
space.
to reschedule this and
Me too.
and go through the complete hell of trying to figure out how to connect with one another. That was a wild start to our introducing ourselves to each other. We just to inform you, we had a connection problem and something was going on. And okay, so Lara, you've got to know, you have been in my screen murky this whole time, and now I can actually see your face. Like as this, I'm not kidding. Yep. Yeah, the whole your whole like it there's no muddiness on the screen right now. But the camera, your face was pixelated this whole time. And as if it was rendering and your voice was in and out, but I trust that the audio did what it needed to do. But right now, as we're wrapping up, now you're in complete clarity. And I just find this extraordinary.
So odd. What is the universe doing? What
I don't
message is being
know.
sent?
But we are along for the ride, aren't we?
Yep,
And
just going with the flow.
yeah, going with the flow. You have brought some really beautiful um offerings today with your story firstly. That is we I hold that. I hold that in incredible sacredness. And I just want to say that I don't know how else to say it, but I feel like most of us who listen to this will hold your heart in our hands, and we appreciate your vulnerability and your connection, um, because that is just, it's beautiful. So I want to just say thank you for that. And then all the other things that you speak about and you touch on, the this thing that I've learned the most from listening to this conversation is that we can heal, and we get to heal in our own time with patience, with compassion for ourselves, and just even saying to ourselves, it's okay. I hear you. I see you. And I'm not going to rush this. I'm just going to move at a snail's pace. And that's okay with me. I think that's what I want to say to myself as I hear you. And intentional awareness is another piece that you offered us, as well as mindfulness and that self love. Mindfulness and intentional awareness is self love, and it is compassion and a deeper love to ourselves. You know, everyone has a story, and this is why I do what I do. And you have just offered yours to us, and I like I say, I appreciate it more than ever. So I just want to say thank you.
Thank you so much, Lori. Um, that was really, really sweet of you to say. And I sincerely do hope that sharing these vulnerabilities can help inspire other people to share their stories, to no longer hide in their shame, like you mentioned before, that uh, speaking your truth, allowing yourself to have a voice and expressing yourself is absolutely a part of self-love. So thank you
Mhm.
so much for allowing me to speak my truth today.
Yes. Well, thank you for being brave and courageous to do it. Your book is coming out. Is it coming out, or is it being written still?
I just finished the draft. It's going to be in editing mode through the summer and likely out in press in early next year. So it's the title is still being determined, but a book about EMDR for trauma-driven depression, and it's integrates, of course, principles of acceptance, mindfulness, self-compassion, and values. Being true
Yes.
to your heart.
Being true to your heart. Um, thank you so much. I just
Thank you.
I look forward to reading this book. And so will you please let me know when it's out, and I'll I have all your socials here. I don't have an Instagram for you. Is that you do not have Instagram?
I don't. Should I get
Don't
one?
No. Well, don't worry about it. I mean, you've got TikTok.
Yes, I have a professional TikTok. I don't. And I've got my LinkedIn and my website where I post some blogs and articles as well.
Yes,
Um, that's all I have for now, and
that's
we'll
okay.
continue to grow that as I fulfill little Lara's dreams to make a big difference.
Yes. Well, little Laura, we love you. And she is making a splash, let me tell you. So
She thanks you.
Is it Dr. Lara Barbir?
That's
Do you,
correct. Yes.
doctor? Yeah, okay. Well, Dr.
Yes.
Barbir, thank you so much.
Thank
It
you, Lori.
was
Thank you
beautiful.
for your podcast.
Yeah, thank you.